Part A. Extract 1. Questions 1 to 12. You hear an obstetrician talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I see you've been referred to me by your GP. How are you feeling today?
Morning, Dr. Rohn. Well, I'm a bit worried, to be honest. My GP sent me here after I gave a urine sample last week. They said it showed signs that I might have diabetes, and I wanted to get some more information about it.
I understand your concerns. Let's discuss everything in detail. First, can you tell me when you started noticing any symptoms or changes?
Sure. It started about 2 weeks ago. I noticed I was feeling unusually thirsty all the time, even though I was drinking plenty of water. I also feel hungry quite often, especially when craving sweet things. I usually have a balanced diet, but lately I've been having sugary snacks, which is unusual for me.
I see. Increased thirst and cravings for sweets can be concerning, especially during pregnancy. Have you noticed any other symptoms, such as weight changes or fatigue?
Yes, actually. I've gained more weight than expected in the last month, and I've been feeling really tired, more than usual. I'm also going to the bathroom a lot more frequently, which I know is common in pregnancy, but it feels excessive.
Those are indeed signs we should take seriously, especially in the context of possible gestational diabetes. Can you tell me a bit about your family history? Is there any history of diabetes or other significant medical conditions in your family?
Well, my mother developed type 2 diabetes later in life, and my grandmother had it as well. As for me, I've always been cautious with my diet because I have celiac disease, so I'm careful about what I eat. But no one in my family has had diabetes during pregnancy, as far as I know.
Thank you for sharing that. Family history does play a role, so it's good to have that information. What about your social habits? Do you smoke or drink alcohol?
No, I don't smoke or drink. I've been extra careful since I found out I was pregnant. I try to eat healthily and stay active, although the fatigue has made it harder to exercise lately.
That's good to hear, Mihiraa. Now, let's focus on your pregnancy. Besides the increased thirst, cravings, and fatigue, have you experienced any other symptoms, such as blurred vision, nausea, or headaches?
Actually, yes. I've had a few episodes where my vision became a bit blurry, especially after eating a big meal. I've also been getting more headaches than usual, and sometimes I feel dizzy when I stand up too quickly.
Blurred vision and dizziness can be linked to blood sugar levels, so it's something we need to monitor closely. Could you describe a specific event when these symptoms were particularly noticeable?
Of course. A few days ago, after dinner, I suddenly felt extremely tired, and my vision got blurry. I had eaten some pasta and a small dessert, which isn't unusual for me. Afterward, I felt lightheaded and had to lie down for a while. It was a bit frightening, to be honest.
That sounds concerning indeed. It's possible that your blood sugar levels were elevated after the meal, which could explain the symptoms you experienced. Now, can you tell me a little about your occupation? Does your job involve any physical strain or stress that might be contributing to these symptoms?
I'm a software developer, so I spend most of my day sitting in front of a computer. It's not physically demanding, but I do get stressed sometimes, especially when deadlines are tight. I try to manage it, but it's not always easy.
I understand. Stress can also affect your overall health, so it's important to manage it as best as you can, especially now. Given your symptoms and medical history, we should definitely investigate further. I'll recommend some tests, including a glucose tolerance test, to check your blood sugar levels more thoroughly.
That sounds like a good plan. Is there anything I can do in the meantime to help manage my symptoms?
Yes, there are a few things you can do. Try to maintain a balanced diet, focusing on low glycemic index foods that won't spike your blood sugar. Regular, light exercise can also help regulate your glucose levels. We might also consider starting you on medication if your blood sugar levels are high, but we'll wait for the test results before making that decision.
I'll definitely try to adjust my diet and stay active. When should I come back for the tests?
I'll have my assistant schedule the test for you in the next few days. In the meantime, if you notice any intensifying symptoms, such as severe headaches, persistent dizziness, or vision changes, don't hesitate to contact me immediately.
Thank you, Dr. Rohn.
Extract 2. Questions 13 to 24. You hear a GP talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I'm Dr. Maven Vans. How can I help you today?
Good morning, doctor. I've been having some trouble with my vision lately. It's been a bit fuzzy, especially when I try to read or focus on something close up.
I see. Can you tell me a bit more about how you're feeling right now?
Well, it's quite frustrating, to be honest. The fuzziness comes and goes, but it's particularly bad in the evenings. Reading has become difficult, and even watching TV is a strain. I'm also starting to get frequent headaches, which I think might be related to this vision problem. It's making it hard to concentrate on work, and I feel like I'm constantly squinting.
That sounds quite uncomfortable. When did you first notice this problem?
It started about 15 days ago. At first, it was just a mild blur, so I didn't think much of it. But over the past week, it's definitely gotten worse. I haven't had any injuries or anything like that, but I did start a new job recently that requires a lot of computer work. I thought it might just be eye strain, but now I'm not so sure. I've tried using eye drops thinking it might be dryness, but it hasn't helped much.
It's good that you've come in to get this checked out. Let's talk a bit about your medical history. Have you had any previous issues with your eyes or vision?
Not really. I've had a bit of mild myopia since I was a teenager, but nothing serious. I wear glasses, but my prescription hasn't changed in years. The only other eye issue I had was about 6 months ago when I had a mild case of conjunctivitis. I used Tobradex eye drops for that, and it cleared up quickly. Other than that, my health has been pretty good. I do have a history of migraines, but they're usually triggered by stress or a lack of sleep.
Thanks for sharing that. Given your symptoms and the recent onset, I think we should do a comprehensive eye exam. First, I'd like to refer you to an ophthalmologist to explore a few different possibilities. They may want to check for conditions like astigmatism, presbyopia, or even early signs of cataracts. It's also possible that the increase in screen time has led to digital eye strain or computer vision syndrome.
That makes sense. What should I do in the meantime?
For now, I'll prescribe Cystane Ultra, to keep your eyes moist, especially if dryness is contributing to the discomfort. I'd also recommend taking regular breaks from the screen. The 20-20-20 rule can be helpful. Every 20 minutes, look at something 20 feet away for at least 20 seconds. This helps reduce eye strain.
I've heard of that. I'll definitely try it.
Good. Depending on their findings, we might consider updating the glasses prescription or exploring other treatment options, such as corrective lenses or specialized eye exercises. If they identify any other underlying issues, they'll guide you on the appropriate treatment path.
I appreciate that. Is there anything else I should be doing?
Yes, a few more things. Make sure you're getting enough sleep and staying hydrated, both are important for eye health. You might also want to adjust your workstation setup to reduce glare on your screen and ensure proper lighting. If your headaches persist or worsen, let me know, and we can look into that further as well.
I will. Thank you so much, doctor.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a nurse talking to a patient called Mihiraa. Now read the question.
Good morning, Mihiraa. How are you feeling today? Ready for your flu shot?
A bit nervous, actually. I've heard the flu shot can cause a lot of side effects.
It's understandable to feel that way. The most common side effects are soreness at the injection site, mild fever, and muscle aches. These usually go away within a day or 2.
Okay, that doesn't sound too bad. I'm more concerned about getting the flu. I have asthma, so I'm worried about complications.
Getting the flu shot is especially important for people with chronic conditions like asthma. It helps protect you from getting sick and reduces the severity of symptoms if you do catch the flu.
I see. Can I take any medication to prevent the side effects?
Yes, Mihiraa, over-the-counter pain relievers like ibuprofen can help with soreness and fever. However, it's best to consult with your doctor before taking any new medication.
Now look at question 26. You hear a doctor talking to a patient's wife called Mihiraa. Now read the question. Mrs. Mihiraa, your husband Mr. Paul has sustained a mild concussion. It's important to monitor him closely for any worsening symptoms.
I'm so worried, doctor. What kind of symptoms should I look out for?
Initially, he might experience headaches, dizziness, nausea, or vomiting. He may also feel confused or have difficulty concentrating. It's essential to avoid strenuous activities, driving, or consuming alcohol until he's fully recovered.
How long will it take for him to recover?
Mihiraa, recovery time varies from person to person. It could take a few days to a couple of weeks. We'll schedule a follow-up appointment to assess his progress. In the meantime, ensure he gets plenty of rest, maintains a balanced diet, and avoids exposure to bright lights and loud noises.
Will he have any long-term effects from this?
Most people recover fully from a mild concussion. However, in some cases, symptoms can persist. We'll monitor his condition closely and provide appropriate treatment if needed. Now look at question 27. You hear a doctor talking to a practice nurse called Mihiraa. Now read the question.
Mihiraa, have you finished the weekly report yet? We need to finalize it before the end of the day.
Almost done, Dr. Martin. I've completed the patient consultations and immunization data. I'm just double-checking the chronic disease management figures.
Great. Have you included the referral data for this week? We need to ensure we're meeting the targets for specialist appointments.
Yes, it's included. There seems to be an increase in referrals for respiratory issues. We might need to schedule extra clinics next month.
Good catch, Mihiraa. Let's discuss that during the practice meeting. Also, have you checked the medication reviews? We want to ensure patients are taking their medication correctly and there are no interactions.
Yes, I've completed the medication reviews. There are a few patients who need follow-up appointments. I've flagged them for your attention.
Excellent. Once you've finished, please send it to me for final review. We need to identify any potential issues early on.
Now look at question 28. You hear a nurse talking to a nursing manager called Mihiraa. Now read the question.
Harry, I'm having issues with the quality of the gloves we're using on the ward. They've been tearing easily, and it's becoming a real problem during patient care.
That's concerning, Mihiraa. Patient safety is our top priority. We can't have nurses risking exposure due to faulty equipment. Have you reported this to the supply chain department?
I did, but they said there's a shortage of medical supplies, and this is the best they can offer for now.
That's unacceptable. We need to find a solution quickly. I'll contact the hospital management about this. In the meantime, can you document every incident of glove failure? We need data to support our case.
Definitely. I've already started keeping a log. I'm also worried about the impact on patient satisfaction. They can see we're struggling.
Mihiraa, it's crucial to maintain a positive patient experience. We'll address this issue promptly. In the meantime, let's explore alternative options, like double gloving or using different types of gloves for specific procedures.
Now look at question 29. You hear a physiotherapist talking to a GP called Mihiraa. Now read the question.
Mihiraa, I'm concerned about Mr. Peters' progress. His physiotherapy sessions aren't showing the expected improvement in his knee mobility.
That's interesting. Has there been any increase in pain or swelling?
Not really. The pain seems to be manageable. It's more about a stiffness that's limiting his range of motion. I've tried different techniques, but there's minimal progress.
Have you considered any underlying conditions that might be affecting his recovery? Perhaps we should order some blood tests to rule out any inflammatory issues.
That's a good point. I'll discuss it with Mr. Peter and see if there's anything else he's been experiencing. Maybe there's a psychological component affecting his recovery.
Absolutely. Sometimes, pain can be influenced by emotional factors. Let's refer him to the pain management clinic for a comprehensive evaluation.
That sounds like a good plan, Mihiraa. We need to address this holistically. I'll schedule the referral and keep you updated on his progress.
Now look at question 30. You hear a nurse talking to a patient called Mihiraa. Now read the question.
Good morning, Mihiraa. How are you feeling today? Are you comfortable using the wheelchair?
It's okay, but I'm finding it a bit difficult to maneuver in tight spaces.
That's understandable. It takes some time to get used to. We can practice navigating different areas together. Remember, it's essential to lock the wheels whenever you stop to prevent accidents.
I'm worried about losing my independence. I used to be so active.
It's natural to feel that way, but using a wheelchair doesn't mean you're completely dependent. We can work on strengthening your upper body to make transfers easier. There are also adaptive equipment options to explore, like reachers and dressing aids.
I'm concerned about pressure sores. How can I prevent them?
Regular skin checks are crucial, Mihiraa. Shifting your position every 2 hours, using pressure-relieving cushions, and maintaining good hygiene can help. We can also teach you some exercises to improve blood circulation.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a dietitian, Dr. Mihiraa, and an interviewer. Dr. Mihiraa, thank you for joining us today. To start off, could you please explain what is meant by a perfect diet for a human being?
The concept of a perfect diet is multifaceted and can vary greatly depending on the individual's physiological needs, lifestyle, and even cultural background. Generally speaking, a perfect diet is one that provides all the essential nutrients, including macronutrients like carbohydrates, proteins, and fats, as well as micronutrients such as vitamins and minerals, in the right proportions to maintain optimal health. It's about achieving a balance that supports both physical and mental well-being while also being sustainable over the long term. However, it's crucial to understand that there is no one-size-fits-all diet. What might be perfect for one individual may not work for another due to differences in metabolism, activity levels, and even genetic predispositions. Additionally, external factors such as environmental sustainability and ethical considerations, like animal welfare, can also play a role in defining what a perfect diet means for different people.
That's an interesting point. Considering the complexity of individual needs and circumstances, is it truly possible for someone to achieve a perfect diet?
Achieving a perfect diet is theoretically possible, but in practice, it's quite challenging. The human body's nutritional requirements are dynamic and can change based on numerous factors like age, gender, health status, and activity levels. For instance, an athlete's diet would need to be different from that of a sedentary office worker. While we can strive to come close to an ideal diet by focusing on variety, moderation, and balance, external factors such as food availability, affordability, and personal preferences can complicate this pursuit. Moreover, the concept of perfection in diet is not static. Nutritional science is constantly evolving, and what we consider to be a perfect diet today may change as new research emerges. Therefore, rather than aiming for perfection, it's more practical to focus on continuous improvement and adapting to one's changing needs.
With the rise of plant-based diets, many people are wondering whether a vegan can achieve a perfect diet. What is your take on this?
A vegan diet can certainly be aligned with the principles of a perfect diet, but it requires careful planning to ensure that all nutritional needs are met. Vegans need to be particularly mindful of certain nutrients that are more readily available in animal products, such as vitamin B12, iron, calcium, omega-3 fatty acids, and complete proteins. These can be obtained through fortified foods, supplements, or specific plant-based sources like legumes, nuts, seeds, and leafy greens. For example, vitamin B12, which is essential for nerve function and the production of red blood cells, is not naturally found in plant foods, so it must be supplemented or consumed through fortified foods. Iron from plant sources is less readily absorbed by the body compared to iron from animal sources, so it's important to consume it with vitamin C-rich foods to enhance absorption. With careful planning and perhaps some supplementation, a vegan can indeed maintain a diet that is as close to perfect as possible.
Speaking of supplements, Mihiraa, are multivitamins helpful in meeting the needs of a perfect diet, or are they unnecessary?
The role of multivitamins in achieving a perfect diet is a nuanced topic. Multivitamins can be beneficial, especially for individuals who may have specific dietary restrictions, are dealing with chronic illnesses, or have increased nutritional needs that are not being met through diet alone. For instance, someone on a calorie-restricted diet or with food allergies might find it difficult to get all the necessary nutrients, making a multivitamin a helpful addition. However, it's important to note that multivitamins should not be seen as a substitute for a healthy, balanced diet. Whole foods provide not just vitamins and minerals, but also a wide array of other beneficial compounds like fiber, antioxidants, and phytonutrients that work synergistically to promote health. Moreover, there is evidence that taking high doses of certain vitamins and minerals can be harmful, potentially leading to toxicity or interfering with the absorption of other nutrients. Therefore, while multivitamins can fill in the gaps, they should be used judiciously and ideally under the guidance of a healthcare professional.
Lastly, Dr. Mihiraa, what are your personal recommendations for someone striving to achieve a perfect diet?
My recommendations for achieving a perfect diet revolve around the principles of balance, variety, and moderation. First and foremost, it's important to consume a wide range of whole foods, including plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. This ensures that you're getting a broad spectrum of nutrients that your body needs to function optimally. Portion control is also crucial. Even healthy foods can contribute to weight gain if consumed in excess. Secondly, I advise paying attention to the quality of the food you eat. Opt for organic or locally sourced products when possible, as they tend to be fresher and more nutrient-dense. Also, minimize the intake of processed and junk foods, as these are often high in empty calories and low in essential nutrients. Finally, stay hydrated and listen to your body's hunger and satiety cues. If you're feeling stressed or anxious, seek healthy ways to cope that don't involve emotional eating. Remember that a perfect diet is not just about what you eat, but how you eat. Taking the time to enjoy your meals, eating mindfully, and maintaining a positive relationship with food are all integral parts of a healthy diet.
Now look at extract 2. Questions 37 to 42. You hear a dermatologist talking about the advancements at the Mihiraa Research Center. You now have 90 seconds to read questions 37 to 42.
At the Mihiraa Research Center, the latest advancements in skincare revolve around innovative approaches that merge cutting-edge technology with advanced dermatological science. These developments include the integration of artificial intelligence, AI, in diagnostic tools, the enhancement of bioengineered skin tissues, and the use of nanotechnology in skincare products. A prime focus has been placed on personalized skincare regimes driven by genetic data, allowing for highly customized treatments that cater to individual skin needs. This personalized approach is rooted in the study of skin microbiomes, where the interaction of microorganisms on the skin is analyzed to create targeted therapies. These advancements are not just about treating skin conditions, but also about promoting overall skin health and resilience, marking a shift from reactive to preventive dermatology. These developments at Mihiraa are set to redefine skincare, transcending the traditional boundaries of dermatology. The impact of these advancements on the field of dermatology is profound. By enabling more accurate diagnoses and offering tailored treatments, these innovations significantly improve patient outcomes. The AI-driven tools, for example, reduce the margin of error in diagnosing skin conditions, thereby preventing misdiagnosis and ensuring that patients receive the most effective treatments from the outset. This not only enhances the quality of care, but also increases the efficiency of dermatological practices. Furthermore, the development of bioengineered skin tissues has far-reaching implications for the treatment of complex skin conditions. For patients with extensive skin damage, this technology offers a lifeline, providing new skin that integrates seamlessly with the patient's own tissues, reducing the risk of rejection and promoting faster healing. The use of nanotechnology in skincare products is another game-changer, particularly in the realm of anti-aging and skin protection. By allowing active ingredients to penetrate deeper into the skin, nanotechnology enhances the effectiveness of these products, leading to more visible and long-lasting results. Measuring progress in these dermatological advancements requires a multifaceted approach, combining clinical trials, patient feedback, and long-term studies. Clinical trials remain the gold standard for assessing the efficacy and safety of new treatments and products. These trials are meticulously designed to evaluate various parameters, such as the rate of skin regeneration, the reduction of symptoms, and the overall improvement in skin health. Patient feedback is another crucial component in measuring progress. This feedback is particularly valuable in the context of personalized skincare, where patient experience plays a key role in refining and optimizing treatment protocols. Long-term studies are essential for assessing the sustainability and durability of the results achieved through these innovations. These studies track patients over extended periods, providing valuable data on the long-term effects of treatments and products. Implementing these advancements in dermatological practices requires a collaborative effort between researchers, clinicians, and industry stakeholders. The first step involves the integration of AI and other technologies into clinical settings, which necessitates significant investments in infrastructure and training. In the case of bioengineered skin tissues, implementation involves the development of standardized protocols for their use in clinical settings. This includes establishing guidelines for patient selection, preparation, and post-treatment care to ensure the best outcomes. Collaboration with bioengineering experts and biotechnologists is crucial in this regard, as it allows for the continuous refinement of these protocols based on the latest research findings. For nanotechnology-based skincare products, implementation involves close collaboration with the cosmetic industry. This partnership ensures that these products are manufactured according to the highest standards and are readily available to consumers. The future scope of these dermatological advancements is vast and promising. The ongoing research at the Mihiraa Research Center is expected to lead to further innovations that will revolutionize skincare. One of the most exciting areas of future development is the potential for regenerative medicine to be applied more broadly in dermatology. Another promising area is the continued refinement of AI-powered diagnostic tools. As AI technology advances, these tools are expected to become even more accurate and versatile, capable of diagnosing a wider range of skin conditions and predicting the outcomes of different treatments with greater precision. This could lead to the development of fully automated diagnostic systems that can be used in remote or underserved areas, making high-quality dermatological care accessible to a broader population. Nanotechnology is also expected to play an increasingly important role in the future of dermatology. Researchers are exploring new ways to harness nanotechnology for drug delivery, which could lead to the development of more effective treatments for chronic skin conditions such as psoriasis and eczema. Additionally, the use of nanotechnology in anti-aging products is likely to expand, with new formulations offering even better results with fewer side effects. The reliability of these dermatological advancements is backed by rigorous scientific research and extensive clinical testing. Each innovation undergoes a comprehensive validation process to ensure that it meets the highest standards of safety and efficacy. For instance, AI-driven diagnostic tools are continuously updated and refined based on new data, ensuring that they remain accurate and reliable over time. Bioengineered skin tissues are subjected to strict quality control measures to ensure that they are safe for use and that they integrate well with the patient's skin. In addition to scientific validation, the reliability of these advancements is also reinforced by the growing body of evidence from real-world applications. Dermatologists around the world are increasingly adopting these innovations in their practices, reporting positive outcomes and high levels of patient satisfaction. This real-world validation is crucial, as it demonstrates that these advancements are not only effective in controlled clinical settings, but also in everyday use. The ongoing commitment to research and development at the Mihiraa Research Center further enhances the reliability of these innovations. By continuously exploring new ideas and refining existing technologies, the center ensures that its advancements remain at the forefront of dermatological science.
That is the end of your OET listening test. Now check the answers.